a press release was issued a few weeks ago, but the full data set's being issued today. And really looking at the primary endpoint, which were more heavily pretreated women with HRD positive ovarian cancer. So there was a 29% response rate present, which was really exciting. And these are patients who are more heavily pretreated, who have very few options. Once they get to fourth, fifth line and beyond, treatment. So this is a good thing. Other results that are being presented are around the germline BRCA cohort. So women who have cancers that have underlying BRCA mutations. And in that population, again, more heavily pretreated, fourth line or beyond, fourth or fifth line, there was excellent response rates. So for women who are BRCA positive tumors, more heavily pretreated, fourth line and beyond, the response rate is about, for platinum sensitive disease, up to a little over 40%. Pretty impressive. Now for patients with platinum resistant cancer, still very good, at around 25%. And the overall population for or BRCA positive cancer was close to 30%. And I think the other telling piece of these results are the duration of response. And the duration of response for the BRCA patient population was over 9 months. For the patients who had HRD positive cancer, more heavily pretreated, fourth or fifth line, the duration of response was little over 8 months. In terms of safety, no new safety signals were observed. We did see a necessity for dose reductions from 300 down to 200, sometimes down to 100, but that's not dissimilar from other trials. I think that the radar data that was presented at SGO a few weeks ago and is now in press in Annals of Oncology really shows that women who are weighing less than 77 kilos and have baseline, or have baseline platelet counts of less than 150,000, we really should be starting those patients at 200 milligrams to avoid the thrombocytopenia as well as the other hematologic toxicities of the 300 milligram dose. And it's interesting that in the NOVA study, dropping the dose from 300 down to 200 did not appear to affect efficacy. So we're pretty confident that 200 milligrams is the right dose for women who are 77 kilos or less or have platelet counts less than 150.